All right, welcome back, everybody. We are here on the Now Morning Show. We thank you for staying with us, and we continue the conversations here right now. I'm going to be speaking this morning with the president of the Arima Business Association, and his name is Rival Chattergoon. Good morning and welcome, sir.
Good morning to you. Good morning to your viewers.
So thank you for joining us this morning. We are chatting and in relation to some of the comments, a statement that you have made on behalf of the Arima Business Association very recently, and it seems to me like you may have a crystal ball.
It's a calculated guess. We did get through the public quite some horrible feedback.
Yeah.
But you know, Arima businessmen and women are a unique set of individuals where we actually care for our employees. Because if our employees are out there as the frontline workers and they are exposed to this, what are we going to tell their family? And if our employees are super spreaders and spread it to our community, what do we tell them? So we understand that is an entire, for our business to be successful, it must not be about who have a yacht every month, every day to go down the islands. It must not be about who have luxury lifestyle. It has to be about the poor man and everybody, because the Arima business community, as most people will know, is the average business person, is not the very rich or the very powerful or so on. So we actually feel the pinch, and we actually know that is we took the bull by the horns and do what needs to be done. Because if I'm to draw your attention to our numbers in the past 3 days, the positive cases are 647. In those 3 days, we have 10 deaths. Where is our healthcare system in all of this? Dr. Richard said we have 10 more days. Can you imagine the chaos that our hospitals will be when in the 10 days, or even as is now? Or is it that we want to see that the hospitals are overburdened, people all on the steps, lie down on the ground, people dying, and then to say, hey, we have a problem now. Our business persons in Arima, and I'm sure it's throughout Trinidad, because I have gotten calls where a lot of them actually agree with our position, has been suffering for many, many months. Since coronavirus took place, businesses are closing every day.
Correct.
So once you acknowledge that we needed to mitigate the spread, then and only then we can go and ask now, well, what do we need to do after? What are the financial support? What are the social implications? How would this affect us? And for that is, I think that we are here now. And rest assured that I'm seeing persons talking about the porous borders and stuff, and we agree with that. But fixing the porous borders at this particular time does not correct the thousands of people who have coronavirus. So it has to be in tandem with each other. It has to be that we have something in place for vaccination. We know that the Supermarket Association, amongst other corporate entities, have been talking about having a source of vaccinations. And we just simply asking the government, this is the time to explore it, even if once they meet that the WHO standards and the standards set by these professionals at the Ministry of Health. I think we are on the right path. But we eagerly await this morning to see what the finance minister is going to come with. We can ask for some stuff like the moratoriums last year really cost an arm and a leg. It was ridiculously expensive.
Correct.
Where we found members who were paying for average $5,000 installment. When we opened back, we're paying $6,000 just for argument's sake. And the reality is that when we do open back, we would not open back with a full bang. It will be cautious. We'll come like we start for the first time, and then it builds. So we need to have at least a 6 to 12-month program for our members and for the entire business community. we probably asking for even the utilities. Maybe now is the best time to reconsider why it is businesses are paying a higher rate for the same exact service. And I'm talking about the commercial residential rates. We are asking for maybe consideration will be given that even disconnection late fees, reconnection fees for these utilities will take into account. And then you have the taxation system. As you know, every Monday we have VAT, we have quarterlies, we have NIS, we have health surcharge. What do we do from here? Are we going to be penalized? We're not saying not to pay, we're just saying that hold your hand on the penalization system until we could put our feet back on the ground. So it is a very comprehensive position that we are in to get out of. But the reality is that we need all hands on deck for this. This must not be about political mileage. It must not be about TV ratings. It must be about the lives of our community. It must be about the economy, yes, but we all are in this thing together. And we are here not because of the businessman, not because of a politician. This is totally on ourselves. We are the ones that rushing to go online and associate when we ought to be in isolation as much as we can, right? And if this is not corrected very quickly, then the only next step for the government to do is a curfew, and that will be detrimental for the recovery. So all what the Arima Business Association attempted to do was to mitigate all the fallouts. And that is why we said that we would support it. And all the detractors that said that, hey, that we disagree with the association are now saying that, yes, we don't see that we have much of a choice. So 4 days before, 3 days before, apparently to some of them, we had a choice. We stand firm and we're saying that we did not see a choice. We did say that it's unfair that vendors could sell and not restaurants who are the pickup and drive-through. And that is in that particular issue. We have seen that we have created super spreaders points from the government aspect, because from the time the government enforces anything, it seems as though that and only then we realize that we want to go for that service, and we create a lot of panic. And I'm begging people of Trinidad and Tobago, please stop spreading the false news to create panic and causing super spreaders points. What is a super spreader point? Super spreader points are that when people have to rush to the supermarket because they think that it's going to close, and you have hundreds of people lining up and have to be there. We're talking about the vendors when they went for the food industry, where you had congregation of 50s and hundreds of people. We are all at risk. I believe yesterday they spoke about people under 40 now actually dying or certainly having this virus.
Mr. Chansagun, you have made statements on behalf of the ABA, that seem to be very measured and also tackling, making suggestions on a lot of issues. But there are certain things I want to track back to. For instance, you said it's an opportune time now for the government to partner with private entities when it comes to getting a source of vaccines and whatnot. In articles that I've read, and I don't know if the stance has changed by many of these suppliers, they are not at this point engaging with private entities, but only through governments and such. How do you suggest the partnership proceed with private sector and the government to make something like this happen, to get more vaccines into the country?
So it is as complicated as it is simple. No supplier seems to be based in the public, because I don't have the information, so I am all subjected to the corrective. No supplier seems to be that it is going to sell an individual or an entity. That is granted. But if I, for some reason, have access, let me put country first and say, you, Mr. Government, look, this is my supplier, some XYZ Limited. They have a supply of 100,000 or one vaccine. Look, you, Mr. Government, you go and buy it. And that is essentially where we are, because if it is not done, if we do not have that mass vaccination process, after this 3 weeks, we are no better of a position that we are in today in the next 3 weeks or in the next month until we reach that herd immunity levels that we're trying to achieve.
All right, Mr. Chattogun, that's all we have time for this morning. I want to thank you for your time and for sharing with us your stance on the lockdown and all these things as well. We are going to take a break right now. That was Rival Chattogun, president of the Arima Business Association. It is now time for your news at 7.